Welcome to Dr. Balga's podcast for the curious doc. Today is March 6, 2026. This video is on a Lancet article released on Lancet March 7th. It's probably already March 7th in England. Titled Effect of Baxdrostat on Ambulatory Blood Pressure in Patients with Resistant Hypertension, the Bax24 trial. It's a phase 3 randomized double-blind placebo-controlled trial. Designed, it was a phase 3 randomized double-blind placebo-controlled trial with 79 sites, 22 countries, 217 adults with resistant hypertension despite 3 or more medications, including a diuretic, and the treatment was only for 12 weeks. Baxdrostat 2 milligrams daily. There were 108 individuals enrolled and placebo 109. Primary endpoint change was in the 24-hour ambulatory systolic blood pressure. What did they find? 24-hour systolic blood pressure reduction by double digits and more, 16.6 millimeters of mercury versus just 2.6 with placebo. Placebo-corrected, it was a 14 millimeter reduction in mercury. A p-value is 0.0001. Additional findings: nighttime systolic blood pressure less than 16 millimeters mercury. 71% achieved ambulatory systolic blood pressure less than 130 versus 17% in the placebo. Safety: adverse events, 52% had hyperkalemia versus 37% in the placebo. That is hyperkalemia greater than 6 millimoles per liter in 3%. Transient eGFR decline but reversible. Conclusion: aldosterone synthase inhibition with Baxdrostat produced one of the largest ambulatory blood pressure reductions reported in resistant hypertension. There's an accompanying editorial or a commentary in the Lancet which talked about this article. It says that high blood pressure affects 1.3 billion adults worldwide. Up to 20% have true resistant hypertension despite guideline therapy. Aldosterone dysregulation contributes to sodium retention, suppressed renin activity, and cardiovascular renal injury. Traditional therapy, spironolactone lowers blood pressure but is limited by endocrine side effects, hyperkalemia, and poor long-term adherence. This new approach, a selective aldosterone synthase inhibitor, example Baxdrostat, blocks CYP11B2 and reduces hormone production. This Bax24 trial showed 14 millimeter placebo-corrected reduction in 24-hour blood pressure, systolic blood pressure, with large nocturnal blood pressure reduction. There are safety considerations including hyperkalemia in about 12%, early reversible decline in eGFR, and limited data on advanced CKD. Key message: promising new strategy for resistant hypertension, but long-term safety and cardiovascular outcomes benefits remain unknown. Wonder how eplerenone does because it doesn't have that many endocrine side effects. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.